Let's go ahead and do a little bit of a dissection of the respiratory system. We can start off here by identifying the larynx. We have the hyoid bone above that and the trachea right here. If we go like this and look at the sternum, let's go ahead and start removing items. So we'll remove the sternum, we'll remove the ribs along here. And we'll do the same thing to the other side. And the muscles here, and the covering of the muscles here of the chest. All right, so when we actually look at the lung itself, the lung is going to be surrounded by a serous membrane on the outside called the parietal pleura. So the visceral pleura is going to be on the organ itself. The parietal pleura is going to be on the outside. So if we remove the parietal pleura, we can see the lung itself surrounded by, again, that visceral membrane, that visceral pleural membrane. And then again, that's going to give rise to the lung itself. If we go over here and remove the heart, just move a portion of the heart. That'll get us a little bit clearer. When we look at the lung itself, we can see that the lung actually has different lobes. The right lung has 3 lobes, a superior, middle, and inferior lobe. The left lung only has 2 lobes because the heart itself is off-centered to the side. So we want to make sure that there's room for the heart to be, so the left lung has a little bit less mass to it. If we were go back under here and remove this covering, we can actually see the lungs themselves, getting rid of the membrane. And if we remove the lung or part of the lung itself, we can actually zoom in and see where the primary bronchi is going to enter with the pulmonary arteries and the pulmonary veins and give rise to the bronchial tree. That's going to bring the air from the trachea, from the outside, into the lungs itself, where we're going to fill up the alveolar sacs where the alveoli capillaries are. That's going to give you your oxygen exchange, where we get rid of carbon dioxide and get rid of and get fresh oxygen into the body. And that kind of gives you an overview between where the lungs are. The place of the lungs where this is called the pulmonary hilus, and that's going to be deep where the pulmonary artery, pulmonary vein, and primary bronchi are going to enter the lung itself. And that's pretty much an overview of the relationship between the heart and the lungs and the trachea.